Okay.
Huh?
With pulse?
With pulse is more beyond, which will even lead to the many other things. But I am just letting you know that cellular nourishment is important. And there we have adapted the therapies of IV nutrition therapy, where we induce vitamins and minerals wherever it is necessary in order to quicken their repair. When we deal with the treatment, yes?
Can I ask a question? I know that in our Western understanding in the hospitals, the vitamin D thesis is very controversial.
Yes.
Some doctors believe, I would say it's a little bit of a belief, like every time in medicine. Some they want to treat everything with it, and some they neglect it completely. So for me, it would be very interesting to understand how your thoughts about the vitamin D factor in this concept would.
Vitamin D, I will definitely not say that every disease can be dealt with vitamin D. But vitamin D is an important factor to deal many diseases, because it not only is the nourishment for bones. When the vitamin D is around 30 to 40 level, it helps to strengthen the bone. That is, it carries the calcium from the blood into the bone, which is very important. Once the deficiencies of the bone is completed, it is equally an immune modulator. The function of vitamin D is as immune modulator. That's where the vitamin D importance comes, and its contribution in many diseases. It is important to maintain the vitamin D levels to some extent, but I do not say that it is the cause of everything. But it's an important factor to maintain, because it affects the immunity. And when it comes to immunity, we have only partial perception about immunity. Whenever I say immunity, everybody think about WBC, the lymphocytes, or the WBC. It is only a part of immune system. The immunity is completely different kind of spectrum. As I have explained before about the trigunas, the sattva, rajas and tamoguna. Immunity is a positive tamoguna quality of the body. See, tamoguna is resistance to change, or resistance to change is called tamoguna. Immunity is resistance to negative change at the body level. So it not only requires only at the time of infection, it requires at the time, almost at every time, wherever there is a cell repair, around each cell, around in every way. So we know that this immunity is only at the blood. It is a part of the immune system which is in the blood, which has different kinds of cells like T lymphocytes and everything, T memory cells. We reached up to T memory cells, but every cell has its own immune bound. Before it gets destroyed, it can be like in the form of anti-radical system, the antioxidant system. It has its small which helps in the ozone. So that activate, it is nothing but an immune at the cellular level. For that also vitamin D is needed.
Thank you very much. It already helps me understand better. One more question I have with this. In the Western hospitals, we often have the discussion whether high dosage vitamin D is beneficial or rather it's a hoax. So this would be very interesting for me to understand if in India you also probably have the same discussion between the parties, and how would be your thoughts about this question inside of this system.
Vitamin D, high levels of vitamin D are needed when autoimmune conditions are there, but we see another hormone in order to decide the dose of high dose of vitamin D, how much we can go to the body. It is again individualistic. Depending upon the parathyroid hormone levels, we decide how much this patient we can go, how much high dose of vitamin D we can go to the patient. We never go to such a level that parathyroid hormone goes down below its normal. As long as it is in the lower end of the normal and we can supplement with the higher dose, the problem doesn't arise. In fact, it helps in healing. It helps in healing many kinds of autoimmune conditions. But once this is losing, then this may cause some disturbance. But with high dose of vitamin D, we definitely ask you to avoid calcium rich food. So this is all conditional. See, in YouTube there is generally people speak about one herb. It is good. It is true, it is good. But for whom is the question. Similar is the vitamin D. Vitamin D is an essential element which we need to maintain. But for the how much we need to take depends on our parathyroid hormone, our calcium absorption. And on what does this depends is our prakriti. The patient with more of kapha condition do not need high levels of vitamin D. If you can observe this with like by the end of just by 40 or 50 units of vitamin D, your parathyroid will go down. For them that is enough to finish their function of vitamin D in a full spectrum. But for especially Vata patients, they need vitamin D in high quantity. Till you take the vitamin D levels to 80 or 90, your parathyroid hormone doesn't go down, your Vata doesn't get balanced. I mean, when you come to the osteoarthritis case, if the patient is more of Vata type, we need high levels. So for us, the guidelines is through pulse. That makes us easy so that we do not miss the line, we do not miss into the toxicity part. Because we could, so that is the best tool which we guide us to limit our treatments. See, no treatment is perfect or no treatment is complete. Whatever the patient need based on his problem. If suppose more of emotional kind, more of flower therapy. Vitamins and nourishment comes at the second or the third level. When the more is of the mind is better and absolutely lack of nourishment, we start with the nourishment. Completely individualistic approach is what leads to successful treatment, is in my belief.
Thank you very much. So do I understand it right that these nutrition therapies are made IV, and are they individually mixed for the patient?
Yes.
Like a cocktail herb?
Yes.
Or decoction, or are they already pre-made?
No, we mix it individually. We never take, in our clinic, we do not take in maximum the ready-made mixed things. We mix it individually. We decide based on the patient. How much is necessary. For sometimes we give high dose vitamin C, but for some time maybe we have prepared based on the severity of the patient's condition 2 doses of high dose vitamin C in a week. But by the way he recovers along with the internal medicine and the 1 dose of vitamin C, if it is necessary or not, we decide and then only we give. Otherwise we just support the body and let the body heal. Only when the body asks, we give.
Thank you very much.
So it's completely individualistic. Okay.
One more.
I have one more.
Yes?
The vitamin D. Because we live in a place very dark in the winter, with a very much lack of sun, we need to take the vitamin D, right, to balance.
Yes.
Is it possible to get this vitamin D from the food intake, or we need it to supplement?
No, vitamin D is not available from food inside. But in traditionally they used to give sesame seeds.
Yeah.
And sesame oil is a good absorption of vitamin D. See, in order to completely utilize vitamin D, it is not only necessary to take the tablets. Along with the tablet, you need to have a good health of the skin, because it is from that medium the vitamin D goes in. As you are taking the tablet, the skin do not play a role. Next is kidney and liver. It should metabolize it in a proper form to get absorbed and hold it for long. It should not be in such a way that you are taking vitamin D for suppose regularly because it's low, and when you stop again it falls back to the low. You should be able to maintain it at least with very minute doses. Then it is fine. We have observed a strange thing that after corona infections, vitamin D levels are drastically down for everybody, irrespective of anything. This vitamin D, B12, serum ferritin levels go down. These 3 things which we observed. That means what we could understand is, because it is an viral, the spike protein might have blocked the receptors which hold at the cellular level. So that is how so food helps, but especially in the vitamin D levels, if you need fat also. To maintain the good vitamin D, compulsory you need a fat, because it's a fat soluble vitamin.
Thank you.
Good fat.
which vitamin?
Huh?
D1, D2, D3, D4, D5?
D3.
D3, but D3 can't be artificially created. D3 can only be created by the skin via UV light.
Yes.
It's the only way.
Yes. Yes.
So if you want to give it via an IV,
No, we don't give an IV.
so
Vitamin D3 we don't go with IV.
you just give what D1, D2, D4, and D5 via IV. Or what?
But what is
I
contained in the tablets that you take?
D2 form.
D2 form.
Then it gets converted into D3. Yes.
By the skin
That's good.
via UV light. This makes sense then.
And we never give IV, we never give because it's a more fat soluble molecule. We give either through IM,
Okay?
muscular,
Okay, yes.
so that it absorbs. We never make it through IV. We haven't practiced it yet.
Okay, but
Yeah, I know it is given in the other things, but we need to.
you could.
Yeah,
You don't.
yes, we mainly stick to IM because it is more absorbable there.
Yes. Correct.
First preference there, then the second one. Okay, sure. So that is the importance of nourishment and immunity also. So the spectrum of functions of immunity is not only fighting of infections, but also to help to repair and to build the immunity so that they are resistant to the negative influences. That is the positive quality of tamoguna, which is adapted. Tamas guna I have explained. I hope you remember. Okay. Okay. So that positive quality is the innate quality of the immunity. So immunity is a very good. At the cellular level, it is called ojas. It is given by the ojas element. I have explained like Sapta Mahadhatus. Out of that, the ojas that gives the immunity to each of the cell. The ojas, tejas, prana of each cells help us to know how much this person is able to heal himself or to heal from infection, or how much he will be resistant to the infection, which can be understood through the pulse. So this is a list where we have given the factors which we deal during the treatment. First, we understand the symptoms and try to clear the dysfunction of the system. We take the symptom only to that extent where we can clear the dysfunction of the present system. Secondly, we try to balance the three doshas, the elements, because by balance of three doshas only we can enter into the healing way. Otherwise, there will be a lot of resistance from our body side to accept the healing, and the body gives symptoms. We realign to back. Suppose it is more of pitta patient. If more of pitta patient, we need to first decrease the pitta. Three doshas are explained in the form of 6 major pathological states. That is, every dosha, like every principle, has its seat, original seat. Like vata is placed always in colon. Pitta has its seat in liver. Kapha has its seat in lungs. This is its natural state. When I am eating potatoes regularly, I am continuously eating potatoes regularly for an year, for 2 years, and without any this. Then the vata starts raising up. That is called vata aggravation. We start the vata. It aggravates to such extent that it starts overflowing from its teeth and gets into the blood. That is what we call rakta vata. Blood is a medium where it can take the dosha to anywhere where it is weak. Here the main point is when one dosha aggravates or increases, the other dosha decreases, because the gunas of the three doshas, the qualities of three doshas are interlinked. For example, vata is more of cold and dry. Kapha is also cold, but it is not dry. It is oily in nature. Pitta is oily but not dry. It's hot. So every dosha has 6 qualities, 6 gunas. That is what I mean by guna, the quality. So dryness is what we see as a symptom, can be due to increase of vata, increase of pitta, or decrease of kapha. It is more like an equation, interrelated. So one, as you go down, another will go up. So that is why we need to make it a balance. We will neither completely reduce the vata, nor we will completely increase the vata or increase one dosha. We need to put it in a balanced state, because while we do like a seesaw, when we are trying to decrease the dryness completely, the oily states increases, go out of proportion. So it is very important to understand what is the problem, whether the patient has lowering of kapha, high vata or high pitta. So the balancing of tridoshas and subdoshas plays a very important role in the treatment, which is guided by the pulse mainly. Just going through the treatment approach which we go through, we are at the gut health. First we have understood the treatment of the symptoms. Now the importance of tridoshas and subdoshas to balance and its necessity to balance. Third is the gut health. Gut is the health of the gut plays a very important role in almost all cases, because it is one kind of junction for even emotional seats. It is also called as second brain. The gut is called the second brain of the human being. So by gut health, we start from north to south. We start healing from the north to the south, right from having good nourished food to how it digests, how much of HCl, if salivation is good, if you drink more water while taking the food, everything matters in this when we evaluate the gut health. Then how much of HCl is there? Do you have the bloating problem? Then if it is a bloating issue, HCl and everything is an improper condition. Then the intestines, the proper production of digestive enzymes, the proper production of pancreatic enzymes, and also the right amount of bile. Liver plays a very important role for the assimilation and emulsification of fats, which is very important for gut health itself. As the food passes into the intestines and small intestine and large intestine, this is the major, along with the digestion and absorption, it plays a very important role in building up the immunity. GALT, G-A-L-T, is a system which is present at the gut level, which is a first step of immunity. Even before the things reaches the blood, the lymphoid tissue which is present at the gut level filters lots of bacteria or the unnecessary toxins. There is another type of immune at the gut which we say as IgA, immunoglobulin A, which is non-inflammatory, which is very important for us, because non-inflammatory immune response is the first step of response which can clear off many kind of diseases. Only when the gut health or semi-permeable nature of the gut is disturbed, then only the inflammatory response starts. This is the main seat for many kind of food allergies, autoimmune conditions, neurodegenerative disorders, and even cancers and all. But we concentrate on gut health even for psychiatric conditions, because it has serotonin levels, the important neurotransmitter to maintain the proper emotional health. So gut health plays a very important role in our treatment. Next comes the liver health. Liver is the largest organ of the body. Along with that, it's a very vital organ. It is seat of many functions. It is the seat of hormones, it is the seat of endocrinal functions, it is seat of metabolism, it is also the seat of Agni. All 13 Agnis which I spoke of has its nourishment from the liver. Proper liver function makes the Agni function properly. It is also a seat of a kind of Pitta, one kind of Pitta called Ranjaka Pitta. I mentioned like there are 5 kinds of Vatas, 5 kinds of Pitta, again 5 kinds of Kapha. Out of that, one of the 5 kinds of Pitta is called Ranjaka Pitta, the Pitta which maintains the blood in red color. It is responsible for that. So that pitta has its seat in the liver. The whole pitta dosha also has the seat in the liver. And also the liver is directly linked to the mind. The mental astral frequencies are linked with the liver. So liver is a very, very important organ, and it is the first organ to detox any toxin which comes into the body. So this health of the liver is a last thing which we generally consider nowadays. Any food we eat has to pass through the liver before it gets assimilated in all the cells. So the liver is in continuous stress. It is very important to see the health and detox the liver timely to function it in the best way. That is the next consideration. Coffee enema plays a very important role in liver health, which is a simple technique which we can do. It also activates the vagus nerve. Vagus nerve, yes, coffee enema.
And ozone.
Ozone, rectal ozone is the best way of.
They included coffee.
Yes. Next is yes, coffee enema. It's a decoction. Coffee. Grounded.
Enema is not drinking the coffee.
No.
Okay.
Reverse drinking.
I didn't hear the word of enema.
No. Actually, vagus nerve is a very important nerve which helps in parasympathetic activation. It is an important nerve which is activated when it is parasympathetic system of nervous system is activated. Nowadays, we are more towards sympathetic system of our whole reactions, our whole activation is more of sympathetic. Generally, sympathetic nervous system is activated when there is stress level. It is fight and fright reactions, everything comes from sympathetic. But actually we need to be more into the parasympathetic system of reaction. We should react or able to handle the stress in a calm way, in a way where we should not disturb the adrenaline levels. So that is where the meditation comes in. The difference between the persons who do meditation or practice meditation or have good is they have their parasympathetic system activated more than the sympathetic. When you are activating your adrenalines frequently, you tend to go into the chronic fatigue syndromes. Your adrenaline fatigue starts. Generally, the stress reaction is just an emergency button. It needs to be dealt only when the situation is triggered to that extent that you have to either fight with it or you have to just run away from it. We should not be activated in every small and PT situations to have to that extent. I mean, small situations we should not react to that extent that either we have to that our adrenaline rush runs in. So that is where meditation helps you with. It balances our meditation, and even the yoga asanas helps in balancing the sympathetic and parasympathetic system, and also keep ourselves to the parasympathetic reaction more compared to the sympathetic. That is about the liver health. And next is Agni. We have already discussed about it. It is an important part of our therapy treatment system. Then is strengthen the organ system, which helps in removal of toxins. Now, detoxification is an important process to maintain the health. We mainly categorize the treatment in 3 ways: detox, repair and nourish, and third is rejuvenate, regenerate. Restore, rejuvenate and regenerate. 3 things. Out of that, first is detox. First, we remove the block. We remove the unnecessary toxin which causes the issue. In order to have the process of detox, we have 6 major systems of detoxifications. Through the pulse, we understand what system of detox is need to be activated in the patient so that his detox is in a pleasant way. It does not cause of adverse reactions, which generally happens when in the process of detox. I mean, any reaction which should not disturb our daily life. That's what I mean by that. So the detox should happen, but at the same time we should be able to carry our daily processes. So for that, it is very important to strengthen the organ which is responsible for detox, and it is individual and it is unique to each one of us. For some, skin is the major organ, for some kidneys, for some liver, depending on our constitution. So before we go for the detox, we need to understand which organ is it, and so that the body can soothingly excrete the toxins out. Next is the cellular health. We have already mentioned about the nourishment. We only are considering nowadays only up to the serum levels, but the real treatment or the real healing starts when there is cellular nourishment. Cellular repair needs to be done. That cellular level has to be handled. That is what we take care when we see about cellular health, and IV nutrition therapy, ozone therapies help us to do this in a best way, along with our the internal medicines. So all the internal medicines are mainly directed towards the cellular health. It's not only works at the serum levels. Next, dhatus, as already I have explained, the 7 constituent elements, it's about that. The health of the 7 dhatus are important. Next, about the immunity. We support the proper building of the mahadhatus which are responsible for immunity. The prana, tejas and ojas. Next, immune sensitivities. Hypersensitivity is also a disorder. To react to hypersensitivity, this hypersensitivity reaction in mind or body, both are related. The people who react to small things or hypersensitively definitely have an hypersensitive immunity, which is now increasing to the allergies tendency in patients. That leads to the allergies which needs to be restored. And next is the restore proper immune function for efficient stress management. This also I have discussed, because that is what I have mentioned as tamoguna, if that is clear. So that is about the immunity. Next important point is homeostasis. Every function, whether it is immunity, whether it is secretion of hormones, have a regulatory factor. One is production when necessary, one is to stop when it is high. Who regulates it is a regulatory mechanism which happens, which is called bioregulatory systems. In our body, 2 systems take care of regulation. Hormones, that is endocrine system, nervous system with neurotransmitters. So as long as these 2 systems are in the right way, maximum disorders do not occur. Or the first disorder starts from the lack of homeostasis. When these systems starts dysfunctioning, the disease settles in our body. Otherwise, it will not settle down in the body to cause us such an inconvenient. So almost every disease, we finally have to correct the nervous system or the endocrine system of the patient, because definitely there would be a disorder, maybe subclinically. We cannot put it in the clinical way like in the blood disorder or through the blood reports, but subclinically there would be definitely some problem with this. And the last is the psychosomatic. So this is the treatment approach and the treatment factors which we go through. So the whole of Mahasiddha Vaidya Chikitsalayam treatment stands on majorly 3 pillars. 1, the holistic and individualistic approach, considering the prakriti of the patient and the disease. Second, to understand the deep cascade of the patient and the depth of the patient, we use the pulse diagnosis. Third is the integrated therapies. We do not oppose any therapy, or we do not say this therapy is wrong, this therapy is not to be done. It depends completely on the patient. Right time, right selection of therapy for the patient gives the solution. That's what we believe in. That's why we have adapted integrated therapies. Actually, this was the integral part of Ayurveda. They used to decide the type of therapies based on the 5 senses. If there was, as I have already explained, if there was an example, there was imbalance in Vata dosha, they used to more go with the sound therapies. More of space element disorders, there used to be light therapies. So that how the integrated therapies were there in the past. Now, due to the medical systems and various conditions, everything has taken up its own individual path. But when we look at it together, everything serves the purpose of our own. Our body is the best example of integration. Each organ has its unique way of developing, its unique way of functioning, but everything serves the purpose of well-being. Similar are the therapies which generally are. When they work together, we can solve the problems in a better way, is what we believe in. So that's why we have the integrated therapies. These are the therapies which we generally follow, but it's not visible, I guess. Yeah. Yes, it's there in the brochure. It's there in the booklet. So we follow functional medicine, which is now available, and then biomolecular medicine, IV nutrition therapy. Biomolecular medicine is more with the plant based. We go with the plant molecules, hydrosol preparations and all. Medical ozone therapy, flower therapy, homeopathy, prolotherapy. Prolotherapy is mainly for pain management in the joints. Acupuncture, it deals with the completely energy systems of the body, the meridians. Again, these meridians are linked up with the organs and the emotions. It is a linking point. If there is an emotional disturbance, it shows its imbalance in the energy meridians and related to the organ. IR sauna bath, it is it is one of the instruments used for detox. Detox in a subtle way. It do not push you to the detoxification. Plasma rich therapy, which is platelet rich plasma therapy, which is a regenerative therapy, and herbal enemas. Rectal route is a very important route of administration which directly nourishes and detoxes the liver. It is the best way to reach the liver than the blood. First, because our colon is completely supplied with the portal veins and direct connection with the portal arteries. So, it is the best way to detox the liver is through the herbal enemas. So, these are the list of the therapies. These are the general systems, general kinds of health disorders we deal with. We definitely pay importance to the diagnosis. But we do not believe in naming the disease. See, actually there are skin problems. Generally patients ask, what is the diagnosis? I say it is a skin disorder. Why to diagnose, why to give a label and put an inception in the mind? See, if I say it as a skin disorder and start treating it, rather than telling you it's a psoriasis and you feel psoriasis, oh my god, it is not curable. You are ready in the mind that it's not curable. That's why I prefer saying it as a skin disorder. That's why if you have observed, I just mentioned the disorder's name. We didn't specifically say like I treat gastritis. It all comes under gut disorders. Naming a disease will indirectly put a label. You categorize yourself. It may be just a label given by the doctor, but maybe some another doctor can diagnose it in another way. So instead of naming it, we say it as a disorder. The system is in disorder, which we need to be ordered. So that is how that's why we didn't go into the name of each disease. So, and this is the last. These are our services which we generally give. One is the pulse diagnosis, individual pulse diagnosis. We tell you the whole probable diseases that is possible for you, or probable diseases you have already faced in past. Second is the treatment when you come either for individual disease or for well-being. There are people who come without any issue. Right now they don't have a problem, but they want to treat for their well-beingness. There we just realign their vikruti, which is in the process of giving a disease back to its prakriti, and make them more immune and stress resistant and all. And third is the lifestyle counseling. we give the special diet in accordance to the constitution, which is and it doesn't cover only like we don't name the diet. You eat on this day this much food. It doesn't work in that way. We completely divide the diet based on the nature of the diet. Like I can just give a small example, like nuts and seeds, more of fat content, it is harmful for Vata people, it is better for Pitta and Kapha people. Like that we categorize. So you have to have nuts in once in 15 days. Vata constitution people will have nuts in once in 15 to 20 days. Then they will be able to digest it. So that is completely a different session where we can understand here in the lifestyle counseling we understand your Agni, your metabolism factor. Based on that we tell your diet. If the Vata people have the Agni in a very we call Vishama Agni, sometimes high, sometimes it goes low, like the hunger is like high, low, again high and low. So there if with that kind of imbalanced Agni, if we give you a heavy diet like nuts and seeds, you will not be able to digest it to the simpler point. You will be able to digest it to some extent, and then later it would be in the form of toxin. Neither it would be eliminated out nor it would be utilized. It will stay in the body and then start giving the diseases. So it's again a broad classification on what kind of diet you take and at what frequency. That determines your lifestyle. So these are the services which we generally provide.
Can I ask a question?
Yes?
Do, for instance, Pitta people have more tendency to get liver problems?
Yes? Yes?
Yeah.
Yeah.
Then I understand.
So this is our system, this is our clinic which is based mainly on philosophy. So we understand you and then we start your treatment. So that's it. This is our clinic.